Well, I think like most people who are still working, it's a little bit different. I am lucky that I'm still able to go to work and I'm still seeing people, and I'm very aware that there's people who are stuck at home without that contact. So in some ways, I'm very lucky. We're running hot sites and cold sites. So the hot sites are the ones that are seeing people who've got illnesses where they're more likely to have symptoms of coronavirus or be able to spread it to our staff, who in these sites are wearing a lot of the protective equipment that you're probably seeing on the news. Um, our rotas are changing on a very regular basis because of people who either got ill or because somebody in their family's got coronavirus symptoms, so they're self-isolating. Our practice was already doing a lot of telephone and email consultations, but now we're doing a lot more, and at the moment not able to see as many people face to face as we'd like. But we are learning to do video consultations, and both the doctors and the nurses and our patients are rapidly getting used to that as a new way of working, which is great. We're getting less admin at the moment, which is a brilliant thing in the NHS, because we're seeing less people, there's less referrals, there's less letters coming back from the hospital. But what this is meaning that we are worried about people who aren't getting the care that they should be. There's people who, this time of year, we'd be seeing people with asthma attacks, we'd be seeing strokes, heart attacks, suspected cancers, and we're not seeing them as much as we normally would. So we are worried that people are at home and not coming to us for whatever reason. So what I would say is the NHS is open as normal. We're doing things a little bit differently, but if you have got anything that you're worried about, or you're feeling unwell, or symptoms you can't explain, then contact your GP or 111 and we will help get it sorted as soon as possible, or reassure you that it's something that can wait. But definitely worth contacting us sooner rather than later, because these things are usually easier to treat sooner, rather than letting it get worse over time. Okay, so yeah, we're open as normal, but learning to cope with doing everything just that little bit differently.